Hi, my name is Faizulis Vides. I'm 31 years old. I'm 5'6", and I have no experience doing handstands.
I'm Steve. I'm 35 years old. I weigh 190 pounds and I'm 5'10". I have no experience performing handstands aside from goofing around when I was a child. This is Conor Doxey. He is 20 years old. He weighs 165 pounds at 5'7". He has no prior experience performing handstands. Handstands were initially performed either using walls or structures for support or by vaulting into the handstand. If using support, the movement began by setting both hands on the floor and keeping both arms straight, then placing one foot as base on the ground and the other foot for impulse. The head must be kept in between the arms for safety. A pillow or any cushionary item could also be placed under the head for safety. Using the base foot, push yourself up towards the wall and straighten your legs up. Keep your body straight for as long as possible. Using a stopwatch, record the time one is able to hold the stand. Time selected for practice was random, based on participants' daily scheduled activities. Practice sessions included 5 days per week, Monday through Friday, with 10 trials per session for a total of 50 trials per week. It was considered to practice Monday through Friday because none of the participants had any experience performing handstands, and also because at least one member lacked upper body strength. The standardized practice selection would help build the muscle strength required to perform a handstand without any support by the end of the project. The length of time was recorded while participants were in the handstand position before falling. A specific time to practice was not maintained so long as the participants were not groggy or sleepy. The time of day was determined to not matter for this skill. Since none of the members of the group were skilled at performing handstands, each session only took a few minutes, depending on the length of time performing and the length of breaks in between each attempt. Breaks were taken only to catch a breath in between trials. No substantial break time was necessary. Breaks were not standardized for each participant because all participants had different physical condition. Therefore, breaks were different for each member. And finally, performance measurements were recorded by using a stopwatch. While learning the handstand, participants focused directly to the development of the physical ability to be able to assume and maintain a straight body line. Since none of the participants had any previous experience performing a handstand, static handstand training was the starting practice point for safety purposes, using a wall for support and slowly progressing to build the strength needed to achieve the goal. Once this position was achieved, balance became the focus to begin the process of strengthening weaker body parts that are important and necessary to perform the handstand. Constant practice was key in the development of this project, along with determination as one of the main characteristics visible throughout the project, because each participant gave their best to try and improve day by day, even though it was not as easy as it seemed. It was also important that each participant remained calm while practicing and not becoming aggravated or irritated if failure were to occur. It was expected that participants would have reached a proficient level of dynamical control by the end of 3 weeks. However, this was not the case for all of them. During the 3 weeks of practice, one participant suffered injury, deterring from the overall group's performance. Trials did not merit a change of condition or increase of difficulty, so structure of the project was maintained throughout its duration for the remaining 2 members. Of the 2 participants who remained uninjured, performance increased each week. However, performance was not as great as the original prediction. But compared to other groups in the discussion posts, it is assumed that participants have been victims of the Dunning-Kruger effect. Participants did not know enough about the motor skill to properly assess the ability to learn it. Participants' abilities were overestimated. The graph shows the progress obtained from the 2 group members and the decline of the injured participant. Despite not meeting our predictions, we are happy with the improvements that we made. We were not able to meet any of our predictions. Those predictions were that we predicted that each member would be able to obtain an absolute retention score of 0, performing as well as on the retention test as the final practice session. We also predicted that each member would increase their times by 1.5 to 2.5 seconds per week, and that by the end of the project, we'd each be able to do a handstand for 10 to 12 seconds. Conor improved by 40%, Steve by 93%, and Faizulis declined by 62%. Conor performed the best, and Steve improved the most. 2 of our project members exhibited learning, but the third suffered an injury and did not, though we expect if uninjured, she would have shown learning as well. We did not meet our retention goal, which was to perform as well as our final practice session. Of those who improved, we were able to show retention versus the first session, and through the data we collected, we conclude that learning occurred.